down healthcare.
Well, Dr. I first want to distance myself from the figures, because if you talk the figures, the budgetary allocation, I mean, you go berserk. You become discombobulated. That's the word of the day.
What does it mean?
You just
confused, like
break it down.
Flabbergasted, if that makes it easier.
Yes.
But I would want to focus on the need for provision and accessibility of quality healthcare. We pride ourselves in wanting to do the last mile connection of electricity off-road because we want people to move freely. But we don't pride ourselves in wanting to establish an infrastructure of health, as you rightly put it, that is quality and accessible to each and every Kenyan, regardless of where you are in this country. In my opinion, that is what the Constitution of 2010 sought to provide to all Kenyans. That wherever you may be, there will be a service center you can walk into. Not even drive, but walk into, because it's supposed to be that close to your vicinity. Whether it's a dispensary, a level 1, level 2, and then, the referral system was established. But today, you realize there is a lot of, brick and mortar construction. You hear of governors saying, I've put up 10 level 2 hospitals, 3 hospitals in my county, or 4 or 5. But when you look at the existing facilities today, pick any level 5 hospital in this county, and you walk in, look at the personnel, the instruments that are, the equipment that are required, they are very wanting. We are losing lives every day. So before we talk about the budgetary allocation, which we will, is there a need? Because you said health should not have been devolved, but is there a need to get the service to Kenyans closer to them? And the only stream for now that we have, the constitutional stream we have, is devolution. Is there a need to do that? And if so, is it correct to say that devolution is not bad? It is the people who are in office who are neglecting their duties. What do you think?
There's a difference in devolving the idea,
right,
and devolving the infrastructure. I think the devolution we had in mind was not about buildings, because buildings, even President Ruto still opens hospitals in KU and E10. Yeah, in the UHC there are certain pillars that give the universal health care. One of them is the infrastructure that you put in place, and I can assure you that right now we haven't passed the WHO GDP population ratio on buildings, facilities. For obvious reasons, that there are kickbacks in constructing them, and the companies that are around it. You see, every governor comes there to construct a hospital, because as they are constructing the health center, pia wanamjengea hotel in the nearby market. You get that? That's one. Yes, the infrastructure. 2 is the pharmacy and the technology around it, the drugs and the ICT. Still pretty well. The still drugs, people are doing good tender business. We have had the managed equipment scheme and all the schemes that brings money.
Albeit fake drugs.
Yes. Then next, you have to have the technology or the ICT to keep the data and records and all that, just database decision making. Then you have to do the HR, the human resource, the people who work inside there. Which side do we have the biggest challenge? And I'll come back to that from the union point of view. But the numbers are low for obvious reasons, that you cannot take his salary. So that they don't really like much about it. Then you have to finance all these things. So that the debate comes about, is it tax-based, in the budgeting, do we do the social health insurance scheme, private insurance, do we take grants from donors and all that? But WHO then adds an overarching pillar of these 4 pillars called leadership and governance. And that's where we have fallen short of glory. That in deciding to devolve healthcare, we did not care about, can we run healthcare 48 different ways? That we have 47 governors doing their own crazy thing. Then we have national government doing their own stuff. Then you have private sector also receiving almost 60% of the population doing their own stuff, charging their own things. So you have all this madness in the country that there's nobody who can take charge. When the minister tries to take charge, governor says, no, we are independent, you can't supervise us. Every governor says that, for me, my priority this time around is mother and child. You did not focus on. In 5 years, he's gone home. Somebody else comes that, no, for mine, me, I want to focus on community health promoters.
So there is no continuum of care.
Yeah, it's just madness.